So this is our last video on the digestive system. We're going to talk about two things: lifespan changes and a couple common problems with or diseases or disorders of the digestive system. So as we get older, like with most systems in our body, there are changes that happen with the digestive system. Teeth become more sensitive to hot and cold. Gums can recede. Teeth may loosen or fall out. Part of that's due to the gums receding. Heartburn becomes more frequent because the cardiac sphincter loses some of its strength. Constipation becomes more frequent. Nutrient absorption decreases. Accessory organs age, but the effects are less noticeable than some of these others we've talked about. So let's move on to clinical applications. So one problem that we haven't already discussed is hepatitis. Now, hepatitis is a general term that means inflammation of the liver. It's most commonly caused by viral infections, but it can be caused by reactions to some drugs, alcoholism, or sometimes can be an autoimmune problem. The signs and symptoms of hepatitis include having a headache, a low-grade fever, fatigue, vomiting, rash, foamy urine, pale feces, jaundice, and pain. There are several different types of hepatitis. Some of the more common ones, hepatitis A, is usually caused by not washing hands after being exposed to a person with the infection and eating raw shellfish, which can carry the virus. Hepatitis B is sometimes called chronic hepatitis, and it's usually transmitted by blood. Hepatitis C, also transmitted by blood. D is a very severe form, but will only produce symptoms if somebody already has hepatitis B. D is also transmitted by blood. E, F, and G, much more rare. Ulcers, we talked a little bit about. Ulcers are sores in the lining of the stomach, most commonly caused by the bacteria Helicobacter pylorus. They can be caused by reactions to drugs, and certain foods, especially, are known to irritate ulcers, things like spicy foods. Signs and symptoms include pain in the abdomen, blood in the feces. That would be a bleeding ulcer. Gastric reflux disorder, or GERD, is another common problem. Recurrent heartburn. Having heartburn every once in a while, that's pretty normal. But having heartburn several times a week could be a sign of a more serious problem because of the constant heartburn, because of the constant exposure to acids. The esophagus can begin to wear away. So we can treat it with acid reducers, which used to be used to treat ulcers, but we've repurposed those as heartburn medicines, and they do the job. Sometimes surgery is required to strengthen the cardiac sphincter to keep the acid enzymes down in the stomach where there is a protective mucus layer. Again, pain